What's up, TUMNAD lectures? In this video, we are looking at what we call the coronary circulation. If you find it helpful at the end of it all, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. In the previous videos, we have been looking at what we call the different types of the circulations. We looked at what we call the systemic circulation, we looked at what we call the pulmonary circulation, and now we are looking at what we call coronary circulation. Now, the question is, what is coronary circulation? Coronary circulation generally means we are going to be circulating oxygen-rich blood, nutrition-rich blood to the entire heart muscles. That is it. Okay, the circulation of what we call oxygen-rich blood to the entire myocardium, which are the heart muscles. Okay, so now during the study of what we call coronary circulation, we need to first understand when does coronary circulation happen, because it's very much necessary. Now, coronary circulation is only going to be happening during what we call ventricular diastole. What do I mean by this? You know what we call the left ventricle. When the left ventricle contracts, it squeezes the blood as if they never squeezed before, and that blood has to knock what we call the aortic semilunar valve. Now, when the aortic semilunar valve opens, they will allow the blood to flow into what we call the aorta. Now, it means that in the aorta, the pressures within the aorta are going to become super very high, and they're going to become even higher than the pressures in the ventricle. What happens that if the pressures in the ventricle becomes lower than the pressures in the aorta, what happens that the blood will try to first come back to what we call the left ventricle. Now, that one will lead into what we call the closure of what we call the aortic semilunar valve. And in most cases, you're going to be hearing what we call the second heart sound, which we call the DAP. Now, what happens whenever there is a closure of what we call the aortic semilunar valve, this is the only time whereby the blood is now going to be shunted to the right and then the left coronary arteries. Okay, meaning that coronary circulation is only happening during ventricular diastole. That is a point to take. Okay, so now we have said that coronary circulation is going to be starting from what we call the left ventricle. Okay, coronary circulation is going to be starting from what we call the left. Going to be starting from what we call the left ventricle. Okay, so now when the left ventricle contracts, it will push this blood to knock one of the beautiful kind of the valves which we call the aortic semilunar valve. Okay, so now our second step is going to be what we call the aortic semilunar. Okay, aortic semilunar valve. Okay, and then when this aortic semilunar valve opens, they allow now the blood to go to what we call the aorta. But something which is very beautiful is that the aorta is going to be divided into three portions. We have what we call the ascending aorta, we have what we call the aortic arch, and then the descending aorta. Our coronary arteries are going to be part of what we call the ascending aorta. That is something which is very much beautiful. Okay, so now from the aortic semilunar valve, this blood will now enter what we call the ascending aorta. Okay, we enter into what we call the ascending. We'll enter into what we call the ascending aorta. Now, as we have said that during ventricular diastole, the blood will try to first come to what we call the left ventricle, which will cause the aortic semilunar valve to close. And once it closes, this blood will be now shunted to what we call the right and then the left coronary arteries. So now this one here is going to be what we call the right coronary artery, and then this one here is going to be what we call the left coronary artery. Okay, so now this one here is going to be what we call the right coronary artery. Okay, and then this one here is going to be what we call the left coronary arteries. Okay, so now we're going to go ahead and see how these kind of the coronary arteries are branching further to make sure that the entire myocardium of different parts of what we call the heart gets supplied with oxygen-rich blood and even also nutrition-rich blood. And then at the end of it all, we shall need to drain out all that kind of the oxygenated blood back into the heart chamber, which we call the right atrium. Okay. Now, starting off from what we call the left coronary artery. Now, this left coronary artery is going to be passing what we call the atrioventricular groove. Okay, is that kind of the sulcus where it's going to be moving. So now, as it moves down, it's going to be giving off different kind of the branches. What are these kind of the branches? There are going to be two major kind of the branches. However, there's also going to be another kind of the minor branch. Okay, but the two kind of the main branches of what we call the left coronary artery is going to be what we call the left anterior descending artery. Super very important. Okay. The first one is going to be what we call the left. It's going to be what we call the left anterior, the left anterior, the left anterior descending, the left anterior descending artery. Okay, which is sometimes pronounced as what we call the LOAD. Okay, this kind of the artery is super very important in a way that it supplies the biggest percentage of what we call the left ventricle, okay, or the apex of what we call the left ventricle. It supplies the bigger part. And this kind of the artery is going to be much common, especially whenever you have what we call atherosclerotic plaques. They like clogging in this kind of what we call the left anterior descending artery. Okay, and that's why it is sometimes notified as what we call the widow marker, because whenever any kind of the athletic plaque clogs on this kind of the left anterior descending artery, the left kind of the ventricle is going to be becoming ischemic, and eventually it will lead into what we call the MOI, which is what we call the myocardial infarction. So now this left anterior descending artery is super very important. Okay. And then another kind of the branch of what we call the left coronary artery is what we call the circumflex artery. Okay, is what we call the circumflex. Okay, the circumflex artery. Now, this kind of circumflex artery is also going to be supplying some little part of what we call the left atrium, and even also some part of what we call the left ventricle. Now, what is very unique is that this kind of the circumflex artery, it also gives off a very kind of the small minor of the artery, which we call the left marginal artery. So now, what do I mean by this? So now, if this is going to be now our left coronary artery, it's going to be giving off different kind of the branches. So now, this is going to be what we call the left anterior descending artery, and then this one here is going to be what we call the circumflex artery. What happens that the circumflex artery gives off a very small kind of the artery, which is what we call the left marginal artery. So now this one here is what we call the left marginal artery. Okay, and then this one here is what we call the circumflex artery. Okay, so now they are all going to be supplying the left side of the heart, especially what we call the left ventricle and what we call the left atrium. Okay, it is such another a beautiful thing. So now I'm putting off what we call the left coronary artery. Let's look at what we call the right coronary artery and see exactly as it moves on what we call the atrioventricular groove. It gives off two main kind of the branches. What are the two kind of the branches? The first one is what we call the right marginal artery. Okay, is what we call the right marginal artery. Okay, is what we call the right marginal artery. And of course, this right marginal artery is going to be supplying what we call the margins of what we call the myocardium of what we call the right ventricle. Super very important. And then besides that, as this kind of the right coronary artery, as it gives off what we call the right marginal artery, we have another kind of the branch which goes and then coils at the back, especially what we call the interventricular septum. This kind of the branch of the right coronary artery is what we call the posterior descending artery. Okay, is what we call the posterior descending. Okay, posterior descending artery. Super very important, supplying on what we call the right myocardium, the right ventricle, and even also some portion of what we call the septum. Okay, super very important. So now these are going to be the major kind of the branches of what we call the coronary arteries, and they are supplying different individual myocardium within what we call the heart. Now, what is very unique is that all these kind of the arteries are going to be supplying this kind of this tissue here, which we are calling the myocardium, what we call the heart muscle. So now the whole of this kind of this structure here is going to be representing what we call what we are calling the myocardium. Okay, so now this one here is going to be what we call the myocardium. Okay, so now all these ones are supplying what we call the myocardium. Now, what is very beautiful is that this kind of right marginal artery, it will then further break into what we call right marginal arterioles, and then eventually into what we call the capillaries. Again, the same happens with what we call the posterior descending artery. It will also break into what we call posterior descending arterioles, and then eventually what we call the capillaries. Again, with the same on what we call left anterior descending artery, it will branch into what we call left anterior descending arterioles, and then finally into what we call the capillaries. And lastly, what we call the circumflex artery will also branch into what we call circumflex arterioles, which are going to be now in what we call the myocardium, leading to what we call the capillaries. So now it is within these capillaries that you're going to be having exchange of different substances within what we call the myocardium. Okay, it is such another a beautiful thing. So now what happens is that after they use that blood, it has to be drained off the myocardium. Okay. Now, how does this one happen exactly? So now what happens is that you're going to be having what we call post-capillary vessels. And when we talk of post-capillary vessels, you're going to be having what we call the venues. Okay? It means that in this kind of the blood, we are now having deoxygenated blood, which is having a lot of the toxins, which is having a lot of the carbon dioxide. It has to be drained to what we call to the right atrium, from where to go to the right ventricle, and then to put to the coronary circulation to drop the carbon dioxide, and then it gets what we call the oxygen. Okay? So now what happens is that the myocardium, which is going to be supplied by what we call the right marginal artery, is going to be drained by super very important kind of the vein, which we call the small cardiac vein. Okay, this one here is what we call the small cardiac vein. Super very important. And then also the myocardium supplied by what we call the posterior descending artery is going to be drained by what we call the middle cardiac vein. Okay, what we call the middle cardiac vein. Okay, and then even also the left anterior descending artery is going to be now that myocardium supplied by this kind of the artery will be drained by what we call the greater cardiac vein. Okay, it's what we call the great cardiac vein. And then the last one is going to be now the circumflex artery. That area is supplied by what we call the circumflex artery will be drained by what we call the posterior vein of the left ventricle. Okay, what we call the posterior vein of left ventricle. So what is very unique is that after these veins have drained all the used up the blood from this kind of the myocardium, they are all going to be dropping in one big kind of the vein. You see now the small cardiac vein is draining here, the middle cardiac vein is draining here, the great cardiac vein is draining here, and even also the posterior vein of the left ventricle is also draining here. You know how this great vein of the vein is called? This big kind of the vein is what we call the coronary sinus. Okay, this one here is what we call the coronary sinus. Okay, and of course this coronary sinus is going to be opening in what we call the right atrium. Super very important. If you remember very well, when we were talking about the anatomy of the heart, we talked about what we call the location of what we call the coronary sinus. Okay, and eventually the coronary sinus will now convert all this blood and pours it into what we call the right atrium. Okay, so now our last portion is going to be what we call the right atrium. Okay, what we call the right atrium. Okay, and of course the right atrium will allow now the blood to pass through what we call the tricuspid valve into what we call the right ventricle, and from there the right ventricle will squeeze this blood as if it has never squeezed before to enter what we call the pulmonary circuit, from where you're going to be dropping the carbon dioxide and to pick what we call oxygen. Okay. So now that briefly covers what we call the coronary circulation. Let's just have a very quick recap. We said that coronary circulation is going to be happening during ventricular diastole. What do I mean by this? When the left ventricle contracts, it will push the blood to what we call the aorta. From there, the pressures within the aorta is going to become too high compared to what we call the left ventricle. What happens that the blood will try to come back, which will make what we call the aortic seminal valve close. Once it closes, it will shunt the blood to what we call the right and then the left coronary artery. Now, the right coronary artery is going to be dividing into what we call the right marginal artery and what we call the posterior descending artery, which are going to be supplying different portions of what we call the myocardium. The same is happening with what we call the left coronary artery. Will divide into what we call the left anterior descending artery, and even also what we call the circumflex artery. However, the circumflex artery can also give off a very small kind of the minor kind of the marginal artery, which we call the left marginal artery. They are all going to be supplying the different portions of what we call the myocardium. What happens that the used up blood is going to be drained by what we call the small cardiac vein to those areas supplied by what we call the right marginal artery, and then the middle cardiac vein to those areas supplied by what we call the posterior descending artery, and then the great cardiac vein to those areas supplied by what we call the left anterior descending artery, and even also what we call the posterior vein or the left ventricle to those areas supplied by what we call the circumflex artery. Eventually, all the deoxygenated blood will converge to this kind of the big kind of the vein which we are calling the coronary sinus, and then the coronary sinus is going to be opening into what we call the right atrium. And of course, the right atrium will allow the blood to bypass what we call the tricuspid valve into the right ventricle. And then the right ventricle will squeeze this blood into what we call the pulmonary circuit to drop carbon dioxide and pick what we call oxygen. Okay? So in this video, we have covered what we call the coronary circulation. And if you think whatever I've talked is making sense, is adding to you, you are benefiting, please, you can support me. And that one can be done by a couple of means. Hit the like button, comment down in the comment section, and please subscribe. So now what I'm going to do is I'm going to give you now a clean kind of the picture which is going to be illustrating all these kind of the branches of what we call the coronary arteries, both the right and then the left coronary arteries, and all the other proceeding kind of the branches in a clear picture view. As always, TUMNAD, until we meet next time.